A shocking development has emerged in the world of public health, with the US Centers for Disease Control and Prevention, CDC, set to welcome 5 new advisors to its vaccine committee this week. This move has raised eyebrows and sparked concern among health experts, as it appears to signal a growing anti-vaccine sentiment within the committee. Some of these new members have little to no documented experience with vaccines, while others have actively questioned the safety and effectiveness of vaccines and other crucial measures to control infectious diseases. This news comes at a critical time, following the resignations of senior health leaders who felt ignored or pressured to engage in unscientific processes, including changes to COVID vaccine eligibility and access. It's concerning that these individuals seem to have been selected not for their expertise in vaccination, but for their vocal skepticism, particularly regarding COVID vaccines, said Tara Smith, an epidemiology professor at Kent State University's College of Public Health. I fear they may use their positions to further restrict vaccine access, given the posted agenda, she added. Jessica Steyer, a public health scientist and founder of Unbiased Science, emphasized that the issue goes beyond individual members. What's notable is the systematic replacement of career vaccine experts with appointees who have publicly challenged established vaccine science. The timing couldn't be worse, Steyer continued. We're currently experiencing measles outbreaks, and respiratory virus season is approaching. Policy changes based on misinterpreted data will have immediate, real-world consequences. Even if the votes ultimately support these vaccines, the public displays of vaccine skepticism and anti-vaccine rhetoric are causing significant harm. On Thursday and Friday, the Advisory Committee on Immunization Practices, ACIP, plans to vote on 3 critical vaccines: the measles, mumps, rubella, and chickenpox vaccine, the hepatitis B vaccine given at birth, and COVID vaccines. These upcoming votes threaten parental choice, Steyer warned, without ACIP recommendations. Insurance coverage for these vaccines may be at risk. The Vaccines for Children program could stop providing them. Families who want to protect their children may find themselves without that option. The former top official in charge of vaccination at the CDC has expressed concerns about the potential delay in the hepatitis B vaccine recommendation, which could shift from birth to 4 years of age. This change could lead to a resurgence of the virus among young people in the U.S., where it has already dropped by 99%. The committee may also further narrow its COVID vaccine recommendations, presenting unverified VAERS reports as confirmed vaccine deaths. This tactic, Steyer argues, is akin to treating every 911 call as proof of a crime. Several of the new members have a history of opposing vaccines, especially COVID vaccines and precautions. Catherine Stein, a professor at Case Western Reserve University School of Medicine, has publicly rejected precautions like wearing face masks, citing her religious ideology. She has argued that as Christians, we should not fear death, and has downplayed the severity of the virus, even during deadly waves. In her personal capacity, Stein has worked as a researcher for Health Freedom Ohio, an anti-vaccine group aligned with Children's Health Defense, now led by Robert F. Kennedy Jr., who is also the head of HHS. She has signed letters urging Trump to reconsider school and daycare vaccine mandates and to focus on ending the persecution of unvaccinated people of faith. Kirk Milhowen, a pediatric cardiologist, has advocated against COVID vaccines due to the rare possibility of myocarditis. He is a senior fellow at the Independent Medical Alliance, formerly known as the Frontline COVID-19 Critical Care Alliance, which has promoted unsafe ivermectin treatments for COVID. The Hawaii Medical Board filed complaints against him, but his license was ultimately upheld. Evelyn Griffin, a former obstetrician/gynecologist who now practices holistic health, has implied that vaccines are unsafe. She has participated in events and webinars advocating against vaccine mandates and has spoken about her personal experiences treating post-injection women. Hillary Blackburn, the daughter-in-law of Senator Marsha Blackburn and a pharmacist, has suggested that vaccines may cause autoimmune issues. Little is known about Raymond Pollack, another new advisor and a transplant surgeon. These new advisors will join 8 others chosen by Kennedy in June after he fired the previous 17 advisors in an unprecedented move. A group called the Evidence Collective has documented more than 50 falsehoods from the first meeting of the new ACIP group. With up to 19 members on the vaccine committee, there are still 6 potential spots to be filled. The vetting and training process for new advisors typically takes months or even years. This development has sparked a heated debate among health professionals and the public. What are your thoughts on the matter? Do you think these appointments will impact vaccine accessibility and public health? We'd love to hear your opinions in the comments below.